Hi, Dr. Matt here. Today I want to talk to you about inflammation. Inflammation is a word that you might be hearing more often if you're just reading magazines or even watching TV. And that's because inflammation is the precursor to most of the chronic conditions that plague our society. Things like heart disease, diabetes, cancer, and autoimmunity, and also hypothyroid. Well, what is inflammation? So inflammation is really, when you think about that redness or swelling, right, or what you get on your skin when you injure yourself, that's the inflammation we can see. But there's inflammation that also occurs internally or inside the body, and it's really just a chemical reaction. It's a series of chemicals that take place in your body, in the immune system, that is really good for an acute response to an injury. But when it's chronic and that inflammation festers over time, it can really cause havoc in the body. So it's very important that if we're going to approach our health and we want to feel better, and we're looking at the hypothyroid, we need to bring down inflammation. Or if you're dealing with blood sugar issues, you need to bring down inflammation. Any chronic condition will have inflammation associated with it. So what we do in our office is we test for it. And I often find patients come in with normal lab work, and they're looking at their traditional labs, which is a CBC or a Chem 24. But they're not getting other markers for inflammation. Things like C-reactive protein, ESR, ANA, homocysteine. All of these and more are markers that we can look at to see whether or not your body is showing signs of inflammation. Now you may know you have inflammation already by the way that you feel. Maybe you have pain in your joints, or maybe you feel your thyroid is swollen. Maybe you feel that you're just puffy and that you have swelling in your legs. Those would be pretty obvious signs. But also just being tired all day long, not sleeping well, losing memory, having brain fog. These are all classic signs of inflammation. Anywhere that inflammation presents, it will cause symptoms. So if you have inflammation in your joints, you have joint pain. If you're getting inflammation that's starting to spread to the brain, then you'll have brain fog or depression. I invite you to come in so we can discuss your health history, we can discuss your family history, and from that, we can put together a set of actions, a plan to help you to reduce inflammation. What's quite different about our program is that what we're really trying to do is to help you to support your lifestyle to reduce inflammation by making changes to your diet, taking the appropriate nutritional supplementation that can reduce inflammation naturally so that you can feel as good as you want.